Hello, welcome everyone. I'm so glad you're here. Tonight we're going to be talking about recognizing the signs and symptoms of anxiety and depression in children. So I'm Ashley Ayala. I am a licensed marriage and family therapist and accredited parenting coach. I've worked in clinics as well as elementary schools with children, as well as working super close with their parents. And one of the things that often get brought to my attention the most when I was working with children was anxiety and depression. Parents would come in really concerned about these behaviors with their kiddos. Was it extreme enough to get, services like individual therapy? Or was it something that parents could, kind of tackle on their own? I would get calls about this. What should I do? Do they need to see someone? Is this severe enough? Super lost. And so I thought it would be a good idea to kind of cover the signs and symptoms in children, the different types, as well as how to tackle it at home if your kiddo is showing some of these symptoms, and when to seek professional help when you need just a little extra support. So welcome. If you guys have questions along the way, pop them in the chat box and I will be sure to get to them. So let's cover anxiety first. There are a bunch of different types of anxiety, and I think this is a term that we use a lot. And I want to clarify, it is different than being nervous, right? It's different than just hesitancy to do something, disinterest in doing something. So there are a couple different types of anxiety disorders. The first one is general anxiety. This is the one that typically most people think of when they think of anxiety. It's just an overall sense of exaggerated worry, maybe not on something specific or, something you can totally pinpoint, but you might have a kid who just is a little anxious, just a little nervous, just a little wound up in general. It's kind of like their temperament would be a good way to put it. There's not one particular situation where they're super focused on. It's just overall their temperament in many different areas they just present as a little anxious. And I'll go over how these kind of present as well in a little bit. Also, there's OCD, obsessive compulsive disorder. So this is something a lot of people are very familiar with, right? You have these obsessive thoughts. So you have a thought in your head, something that provokes this desire to do something about compulsion. So you have a thought, and in order to make it go away or to make yourself feel better, a lot of times we need to do something about it. So I say a lot of people throw this term around OCD, like, oh, they're OCD about their house being tidy or about washing their hands. They wash them a couple times a day. But for kiddos, if they're having these symptoms of OCD, it doesn't quite look like that. So sure, they could be a little preoccupied with germs and dirt, but it's not like, oh, we got to wash our hands after we use the bathroom and before we eat. It's like 100 times a day, for example. It's this extreme preoccupation. They might even become really rigid with certain things. So sure, they're not worried about their house being cleaned like how an adult would present, but if things are getting moved around or there's not symmetry or exactness or order, that makes them really upset. They go and they fix it, or they might present as really upset, maybe crying or something if something has been moved or out of place. They might rearrange their items in their room in a very particular way. They're not super concerned with like, oh, this is my special space, I want my things there, but they want it in an exact place. They want it to stay there. If someone comes in and kind of disrupts it a bit, they become overly emotional about it. There's also excessive counting and repeating of words. So not like how a 2-year-old, right? Maybe you're going, look, The bear's going up, 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 and they're going up, up, up. This is like they're kind of in their own little world and they're like saying something. They're repeating a word or a song or certain numbers kind of to themselves, kind of under their breath. And it's not when they're playing or anything like that. So you'll start to notice that it just kind of is it's a little bit odd in comparison to how they might be normally, typically. So that's kind of how OCD can look for kiddos. There's also panic disorder, which is like a panic attack. So this is characterized by unexpected and repeated episodes of intense fear. And this can come out of some of the other examples I've shared. So you might have a child who exhibits signs of anxiety disorder or might have some OCD tendencies, and say you move their stuff in their room around and they start to have like a panic attack. They can go together, right? So you might see them verbally crying. They might be running around. They might be running away from you. They might be breathing really fast. For them, their heart might be racing. They might not be able to calm down quickly in a typical transition, which could take like a minute or two to calm down. They're really struggling and need a lot of intervention from you. So that's a panic attack. There's also post-traumatic stress disorder, PTSD. And I want to spend a little time on this. So PTSD is a response. This is in the anxiety department because it's a response to a terrifying, if not life-threatening event. And it could cause physical harm or just emotionally threaten. Their life felt threatened. So these can kind of vary a lot of the times for kiddos. If maybe they saw they're in an environment where there's violence, whether it's within the home or even living in a community where there's violence as well. It could be something like a car accident that they've experienced or even were witness to. It can cause a child to experience post-traumatic stress disorder. And what you'll see in these kiddos is this hypervigilance. So what that means is they are frequently on edge. They're frequently unable to just kind of be calm, kind of be at baseline. Maybe they're looking around a lot. Maybe they're moving around a lot. It's hard for them to focus. It's hard for them to pay attention. And a lot of times it will come out in school. You'll see them, maybe their grades start dropping because they're not able to pay attention in school. And I like to kind of compare it to a car engine. That's like if you rev it and like if you're flooring it, it's getting really overran and it's wearing on the car, the entire car as a whole. And if for a kid has a frequent state of this hypervigilance, hyperarousal, they have so much stress in their bodies just from even a single event because they're constantly trying to protect themselves. They're constantly trying to prevent it from happening again, even though it may have been completely like a one-time thing or out of their control, like it won't happen again or something like that. Their body is going to always be on edge. Just in a lot of settings. So it could be just frequent, like just sitting in class, or it could be in response to kind of being, maybe they were in a car accident. So every time they get in a car, right, you start to see these anxious behaviors come out. I'll share this story. I was playing hide and go seek with my kids in the backyard a couple months ago, and I'm in California and kind of near the hills and stuff. And I was playing hide and seek with them, and I went behind like the shed we have to look for my daughter, and I saw a rattlesnake there. And I was like, oh my God, my daughter wasn't back there. But it scared me because I thought, oh, what if she was back there? And, my brain went down that rabbit hole of what could have happened. We took care of the rattlesnake, all of that. but I'm not kidding. Every single time I go back behind the shed, I literally look in that exact same spot. Even though we did some work, we covered up all the holes, we did all that. Now it's freezing out. There's no rattlesnakes, but my eyes go exactly to that same spot, and I feel like a little nervous. So that wasn't necessarily a life-threatening event, and I'm an adult, and I can walk through all these things, but it was this hypervigilance of like that threat. And now I'm always a little bit cautious, like my brain just does it. So for kids who have experienced something like this, you might notice if it's around the same environment, if something happened at a store or with a person or something like that, you might start to notice some of these behaviors come out. Another one is social phobia or social anxiety disorder. This is this overwhelming anxiety or excessive self-consciousness in everyday social situations. Now, this is not the same as being shy. So, you know, when a kid is shy, they might be a little slower to warm up. Maybe they hang by you for a bit, or maybe they're okay having a couple friends. They're not super like outgoing. They don't need the big groups, the big birthday parties, all that. That might be just a little too much for them. That's just not who they are. This is more limited to one type of situation, just with a person like getting up in front of people or eating or drinking in front of others, like super specific behavior, or anytime they're around other people at all, they completely shut down. Maybe they shake, maybe they start crying. They really, in any situation, have a really hard time being there. It's physically, like when you look at them, they look physically upset, physically uncomfortable to be there. Or if you say, okay, we're going to go to school now, or we're going to go to this birthday party, they lose it. They cry, they refuse to go, they're kicking and screaming, they don't want to get in the car. Like, it's a bigger deal than just, I'm going to hang by you, mommy and daddy, for a bit, and then later I might run off and go play. They just don't want to go. So thank you. Yes. So would selective mutism fall into this category? And can kids grow out of social anxiety? So that's funny because one of the signs and symptoms under anxiety is selective mutism. So what that is it's a kiddo who refuses to speak in pretty much all settings, no matter what. And this is something definitely that would need to be worked through with a professional. This is more than, I could see why it could kind of be under social phobia. I'd like to see, if I were to diagnose social phobia, I would like to see other indicators, kind of how I shared about going up to other people, going to an event, this like resistance to it. So selective mutism falls into its own category, but under anxiety disorders. It's its own special little thing. So thanks for bringing that up. So with selective mutism, you can get therapy for it. And I have seen kids come out on the other side and start speaking. It's a wonderful thing. And sometimes they may only speak to like one person, but it is something to work for, and it is treatable. And can kids grow out of social anxiety? So again, with any kind of like phobia, something, you know, if you think of like fear of spiders or this and that, there are ways you can address it, and there are interventions you can use over time to help kids feel safer. It's beyond just a confidence issue, like how maybe feeling shy is, where just over time, you know, they'll just kind of find their own, and they're just a little introverted. Like this is, as a phobia, is something you would definitely want to seek support in and have a professional utilize interventions for. Now, a lot of the times you'll catch, out of like all of these anxieties, they can present in a number of different ways, but some of the ways you can see it is like if your kid is having a lot of school refusal, right? They're not wanting to go to school. And it's not just like, because I have a test today, or, something light, like they just are kind of like not feeling like going to school that day. It's school refusal. They're starting to miss a lot of days. You're starting to get calls, absences. It's becoming really tough for you to get your kiddo to go to school. So this can be a bigger sign of anxiety. Also, somatic complaints. So anything in the body. Hey, mom, I have a headache, like right before school, or right before, they're going to go on stage for something, or right before they're going to go meet with a group of people, right? They start complaining about headache, stomach ache, things like that. More than just one time, right? If you called me and said one time a month ago, my son didn't want to go to school and he said he had a headache, but he really didn't. He just didn't want to go. I wouldn't suggest you come into therapy. So that's something you could work on at home, which that I'll definitely get to. Anger and aggression. So sometimes when kids are a little anxious and nervous, it can come out in hitting. It can come out in saying not nice things to the family or siblings or things like that. Sadness even, they can kind of start to withdraw a little bit. You can see it if they're starting to internalize their feelings, right? You have a kid who normally would start talking and sharing things, but now they're kind of pulling back and a little more reserved and not sharing these things with you. And there are some stages where it's developmentally appropriate for your kiddos to start pulling back, right? When they started to get like preteen, and then of course teenagers, that's just a developmentally appropriate thing. But I'd be a little concerned if all of a sudden they are more withdrawn. Obviously, having a big fear about a specific thing, not wanting to do something, not wanting to go somewhere beyond just a normal, I don't want to do it. It's got to be like feet in the sand over at least a couple weeks for an extended, it's excessive. Fear and worry about the future. That's a big one too. Kids will have these conversations with you and they're talking, they might be expressing nervousness around a specific thing like death after, it would make sense if someone just passed away, but like, if they're saying, mommy, I don't want you to leave, I'm scared you're going to die, or mommy, I feel like something's going to happen to you, I don't want you to go, right? And it can also be categorized under the PTSD, right? We could understand if something happened, they'd want to be closer to you, they'd want that sense of security. But if out of nowhere they're just expressing this concern over the future and these what ifs that are impacting their ability, like they're not sleeping because what if they don't want you to even walk out of the room, like that extreme, they need you there by their side, they're bedwetting, like these behaviors that are out of the norm for them and are really persistent. And then also self-harm. If you have a kid who is injuring themselves, a lot of times, and I'm not sure what everyone's age groups are for their kiddos on here, but once you start getting into, I would say 4th, 5th, and 6th grade for sure, these are things I keep my eye out for. And I know it sounds so young, but unfortunately I have seen it as early as like the 5th grade. And sometimes self-harm isn't always cutting. It can be hair pulling. It can be picking at scabs or biting the nails until they bleed. I've seen that in littler ones, biting their nails so much and then it's bleeding. That can be an anxiety disorder. So if you have a kid, right, so your child is showing any of these signs, there are some things you can do. So if you're like, well, they've shown some of the lighter symptoms, right? They've, a couple times have had trouble going to sleep, or a couple times it's been tricky to get them in the car. They haven't been wanting to go to school. So there are some things that I can suggest you do at home. So the first thing I would always say is catching it right there and verbalizing to your kiddo. Wow, I see you really are worried about something. Or oh, you really don't want to go. What's going on? And opening up these lines of communication. You want to summarize what happened. I see you're super angry right now, or I see you're crying, right? You don't want to go to school. Let's start with school because that's the biggie. You really don't want to go to school this morning. What's going on? And like they might say, I don't know. I don't want to go. I just don't like it, right? And you can say, oh, honey, I know it's so tough sometimes, right? We want to validate. It's so tough sometimes when we don't want to go to school or we don't want to do something, and making space for that. So summarizing and validating. And then you can hold their hands, so you can be close to them. A lot of the times, I think it depends on kind of how your child likes to communicate. You can be close with them and rub their back or something, and you can say, honey, I know it's so tough when we don't get to do what we want. And I know you'd rather be here with me. And I'm so curious if there's a way, like if they were playing with something, if there's a way we could stop what we're doing, we could put this on pause and we can play with it when we get home after school. Or, I wonder if we can take this little guy we were playing with and he can ride in the car with us to school. What do you think about that? Or you can also do deep breathing with them too. Like, okay, let's just take a deep breath. Let's just pause for a moment. If they're like not even in that verbal communication stage, like they're just not having any of it. If they are just crying or really refusing, it's good just to kind of get them back down to baseline and just breathing with them and like validating. I know, honey, I know, before you start transitioning to let's stop what we're doing and let's get in the car kind of a thing. There's also bibliotherapy, which is using books to talk about tough, serious issues in a playful way. I have a whole book list on my website with lots of different books to tackle, like worries or anger or things like that. My website is themodernparent247.com, and I'm going to add some on Friday, some more, but there's this book called What to Do When You Worry So Much. It's one of my favorites because it really explains these things in a child-friendly way. It talks about how we grow these worries inside us, but the more we pay attention to them, the bigger and the bigger that they get. So a lot of the times with bibliotherapy is you pick a topic and you pick a book, so worries, and you read about it and you discuss and you want to normalize it for the kiddos, because a lot of the times when they feel like this, like, I don't know if you guys have ever been anxious about something, even if it's something short, like getting a new job or something, or if you've ever experienced panic attacks, but it can be a really uncomfortable feeling. And for kiddos, it's extra uncomfortable because they have barely any coping strategies. They really rely on us for self-regulation. And so with that, when we start talking to them about it and saying, hey, this is something that people have this, remember in this book, we read about it, and this bear was super worried, but this is what he did. And I know sometimes that comes up for you, and I'm here to help you. And we're going to work on this together. We're going to, figure this out together. So books are a wonderful way to talk to your kid about these things. Also, another thing is using logic. So you don't want to use logic right when your kid is in a heightened emotional state. So you want to, diffuse the situation at first. I know it can be easy when your kid is like, I don't want to go, or I'm scared, Mom, there's something under the bed, or, this big fear, of something. And it's easy to go, there's nothing to be scared of, or we've got to get to school. And like, we've all done those things. I still do those things. It's okay if you do that. And to kind of really tackle it head on with your kiddo, the best thing is to make space for that feeling so they can start to bring them back down. And you'll notice maybe they're crying less, or they're screaming less, or they're talking about it a little less in that moment. And that's when you want to start lacing in logic. So you can start going, babe, I know you were a little like, let's think of the logic, for example. If they were nervous to, let's do OCD, because that's a biggie. So say you have a kid who really wants, is really stuck on washing their hands and the fear of, viruses and how it's going to get sick and how we got to keep our masks on and all of this. But it's to the point now where they never want to take their mask off. They are so nervous if you come up to them. They're still doing that like 6 feet away, right? They are not wanting to play with friends. They're not okay. They want to make sure, did you wash your hands, Mom, before you made my food? Like that extreme. You can make sure they're at baseline and then go, baby, I know we talked a lot about these viruses and how they spread and to keep ourselves safe. And I want to let you know that when we're home, when we're together, you are safe with the virus. And I want to let you know that we're doing all that we can to keep ourselves, safe from this. And it's okay if you don't wear your mask in the house. And they might go, but no, right? And they're pushing back. I know it can feel like that because we worked really hard to teach you about that. And as my job as a mom, it's also my job to let you know when it's safe enough to be in another situation where you don't have to have it. So at home, why don't we do this? Why don't we pull it down a little under your nose a little bit? Or if they're like, oh, Mom, did you wash your hands? And you can say like, yes, babe, I wash my hands. And sometimes you can give information on like the good germs, right? It's okay if we introduce, there's lots of different things in our environment that are okay and healthy for our bodies. And our bodies are really, really strong. And they have all these things that fight to keep us healthy, right? So you can start to combat it with like a little logic too. And slowly, this isn't going to be like, okay, Mom, I'm totally better now. But you can start building that, and helping them feel assured. Now, also then the third step is distraction. And again, I say that gently because, a lot of the times as parents, when our kids upset, we want to make them feel better and then like move on to something else. And sometimes it's like they're crying over something and it's like, okay, you're not going to get this now, but you know what you can get here. You can have this instead, because it's uncomfortable for us to sit with that feeling. But this isn't like, this isn't for us, it's for them. And so a lot of the times when working with parents, I like to say, okay, what's coming up for you when your child's going through that? But if you've paused on that moment and you've done the emotion, making space for that, transition to just some logical thoughts here, and then transition out to the distraction, right? The distraction would be, hey, here's our little toy. Why don't we take him in the car with us? Oh my gosh, there he goes. He's running. You're using this playful distraction to kind of transition out of that moment. If we look at it as like this moment where their anxiety is flaring up, we say, I'm here for you. Your feelings are valid. This is why it's my job. This is why I'm telling you you're safe. This is why I'm telling you that it's okay to calm down, right? We're not saying calm down, but I'm telling you this is why it's okay. And then also let's get out of that like big grown-up emotion and let's transition to more of this playful, what you do need to worry about and think about as being your own child, because children don't need to necessarily worry about these big, gigantic things, and it's our job to kind of help them feel safe and secure. So you can also have a special little space, like a calm down space where, they have cozies and loveys and all that space. Or if you had a kid who likes to write, they can write it out or draw it out. So there's a lot of ways you can support them at home when they are showing signs of nervousness and worry. But what do you do when you're like, I've been doing these things and it's just like, it's not working. It's at a 10. I've brought it down to maybe like an 8. And I've also started, seeing you, Ashley, on ParentGood and working through my own like upset and response to this. So now we're at like a 7, but it's not going away. It's been like a solid month and a half, 6 weeks. And we've missed a lot of school. We've missed all the parties, to the point where like not sleeping is in our bedwetting, all of that. This is the time absolutely for professional help, professional support. There's family therapy, there's individual therapy, and that's something that can be so wonderful. It's so good for you to build your toolboxes and meet your kids, but sometimes it's just out of hands, right? So that's when you'd like to bring it up to the kind of that next tier, that next step. And that can really help with addressing it head on and having a clear and solid plan. And the therapist can also work with like the school and things like that. It can be wonderful. So if you have questions about anxiety and how it comes up or anything specific, feel free to pop it in. Right now, I'm going to, in a minute, transition to depression, but I want to make space if you guys have questions about anything I said or anything specific. You can even unmute yourself and we can kind of have a quick back and forth if you have like a little bit more of a layered conversation. So if you do, let me know. If not, I will transition to depression in kiddos. All right. So depression, okay. When my 2.5-year-old is tired or feeling insecure, she makes us repeat certain words and phrases over and over. If we say it, she calms down, but if we don't, then she throws a tantrum. Any insights or tips? How absolutely remarkable. Whatever you guys are doing with your 2.5-year-old is phenomenal. I love that. Mantras. And thanks for bringing that up. So mantras are huge. They are a beautiful way to set the mood, set the tone, bring things down instead of all these intangibles, all these talks. Sometimes we just are like saying all this stuff to make them feel better. But if you pick like a couple words or the mantra and you say it over and over, it's soothing. And I don't know if you guys do like pair it with, I call it snugs with my kids. You want to snuggles or like, if they have a blankie or something like that, that's great. So I wonder if you're asking me that, like if we don't do it and she throws a tantrum with something going on with her or something, is that concerning? I would say no. I think especially at 2.5, I can confidently say you're doing exactly what is right. I have no concerns for your daughter because she's not at a place to self-regulate. Self-regulation, self-soothing comes so much later. And it's because of exactly what you said, that she's going to develop these skills and be able to utilize them later. Like teen, adult, right? All of that. She's going to later go, oh yeah, I know it felt really safe when my parents would do this for me. So I'm going to now kind of do it for myself. And I'm going to journal like my mantras and stick them all over the place and things like that. So that's wonderful. And as far as the tantrum goes, if it's like, I can't get to it right now, or, 3.5, that's perfect. That's still fine too. Totally fine as well. I would say, gosh, I mean, you could, like I said, even adults will use mantras. So, but the tantruming is a normal reaction to, feeling upset about something. She's communicating like she really needs this and she needs your help. And I would say keep doing that. And if there's something like you can't get to it right then for some reason, it's okay to say like, I can't right now, but here's your little lovey, or I'll be right there. Just give me a moment. And it's okay to walk away, even if she's, tantruming or fussing or yelling or something. Go do what you need to do. That's okay to take that moment for yourself and then come back and say, okay, babe, here we go, and help her soothe through the moment. I had another question, curious about how to help a 5-year-old who seems to have health anxiety. We'll point out random body sensations and question them. For example, why does my arm hurt, itch, etc., and tips on how to reassure them. Oh, you guys. So I love that. Again, kids are so amazing. They really communicate so much to us. So I'll break it down into two pieces. I'm going to separate the health anxiety first and just point out that random sensations. I love that they're pulling inward and noticing their body and verbalizing it to you. There's this big curiosity with kids throughout all ages, right? You see it in different ways. They get curious, but especially at this age, they really start to notice things about themselves, things about other people, the differences, things like that. and it kind of becomes, light to them. And so turning to their grown up for to kind of get their questions answered is wonderful. So, why does my arm hurt? Why does my arm itch? No big deal, right? Answer it. I don't know why arms itch. That's a Dr. Google thing. But your arm hurts because of this, or you got a bug bite and this is how it works. So there's a level of just explaining it like a black and white, just this, because they're trying to learn how the world works and how things work. And then also you can even kind of take that to the next step and kind of go, do you ever notice other things in your body? Like when you're nervous, like, does your tummy hurt? Or when you're excited, do you feel like this? Or when you're really happy, where do you feel it in your body? I just always like to give that stuff just for emotional intelligence, laying it down. But also when you said this health anxiety, how to reassure them. So when we think about like health anxiety, or like if someone's had a medical trauma, they'll attach it with more worries. So if it's kind of coming off, not just why does my arm hurt, like an itch, let's Google it, but it's kind of more like my arm hurts, what's wrong with it? Or, oh my gosh, I'm scared I'm going to throw up, or I'm getting sick. What does that mean? Or if they've had an experience like, they've gotten, really sick before and had to spend some days in the hospital, they might be having this upset and this reaction. So one, I'd be so curious, Erin, if, something's ever like happened like that, or if, there's been something related, like a trigger for them to be like that. But if you can't really pinpoint it, and your child is expressing this health worry, this like, health anxiety, as you put it, that's something to definitely kind of tap into a little bit. I'd be more curious, like, is it impacting their ability to function at school? Are they so concerned they're not eating? Are they up late at night, like, mom, stay in bed because, I'm so worried about X, Y, and Z health-wise. And that's when you could kind of get that more professional support to kind of dig in a little bit and offer you guys some guidance. So I hope that answered your question. Okay, so depression. So depression is very, very different from normal, typical sadness. We all get sad. It's okay for kids to be sad because they didn't get their way, or it would be a normal response if, mommy or daddy had to go on a work trip and was gone for a while and they missed them, or you had a pet die and they're still talking about it and they're sad about it. We don't need to we don't need to make everything pathological just because they're experiencing a normal emotion. But when it transcends from just a normal reaction to something to depression, that is when there's a constant feeling of sadness, an overall lack of interest in things, disinterest in one's pleasurable and enjoyable activities. So if you had a kid who really enjoyed seeing their cousins or really enjoyed playing soccer, and then now they're just down, they don't want to play soccer anymore, they don't want to play with their cousins, they just kind of have this apathy to them, and it's to the point where it's stopping them from enjoying typical things. They can be, there's a range from like minor to severe, but depression doesn't result from like a single event, but it's a mix of events and factors. And a lot of times it's genetic, and it's even more of a factor if someone within their life suffers with depression as well. So if someone else in the home really has it, or if grandma has it and you guys are super close and see her often, it comes up more. So some of the signs with depression with kids, and especially boys, is anger. Now, this can be kind of surprising. A lot of times we see kids who are like angry and stuff. We kind of look at more as like they're oppositional, or, they're just being defiant, or, bossy, or things like that. But when you have a kid who's like super cranky and angry and aggressive, a lot of the times underlying, it's depression. And so it can get missed a lot. And a lot of the times it's tough because we respond to the anger very differently than if we were to respond to a kid who was sad. So anger gets in trouble a lot, right? Versus, someone who's just like down and disinterested, you kind of comfort them and try and support them more. So a lot of times that can kind of get overseen. You can see it like social withdrawal. They're not wanting to kind of engage with friends anymore. And this looks different than social phobia or shyness. They're just not really wanting to engage and go to the things. They're not fighting about it. They're not like pushing up and nervous and crying. But they just, no, I don't want to go. I don't care. I don't want it. They can have changes in appetite, either eating a lot and more frequently or lack of appetite as well. Changes in sleep, more sleep or less sleep. Trouble concentrating, fatigue, and low energy. I mean, depression isn't, this is one that it kind of makes sense, a lot of the things you say. This also there's the somatic complaints, stomach ache, headache that don't respond to treatment. Just any feelings of worthlessness. So you might have a kid who's constantly putting themselves down. I can't do it. I'm no good. I'm not good at this. No one cares. No one likes me. I have no friends. Beyond a one-time incident, beyond like going to a park or a play date and then coming out and going, no one likes me. It's frequently, it's over time. It's kind of their overall sense of the way they interact with the world. A lot of the times with severe depression, they have impaired thinking. So it might look like they have, challenges with learning or processing, and it's just the way the brain is. So they have a lot of trouble with concentration, and then also thoughts of death, suicide, things like that. In a lot of the older ones. Again, I think this group has a lot of little ones, but it can come up for the older ones as well. So there are some myths when it comes to depression. So one myth is that sadness looks the same in children as adults. And, the thing is with kids is they don't have that verbal language or like the cognitive savvy to express exactly what's going on, in the textures of how like you and I would if we were talking. Usually it comes out in these behaviors that we have to decode as parents. We have to look and go, that's kind of odd. Like, why aren't they wanting to do this? Or you're starting to have more play dates and you're going, my child is just engaging in the world a little differently, as far as their mood goes. They'll have more of those body symptoms like aches and pains or fatigues, things like that, or feeling irritable. So it kind of can come out a little differently because they're not verbalizing it in the same way that we're used to, maybe. Another myth is that this chronic sadness, this depression will go away on its own. So it's not something that kids can just grow out of. It's not something that's like, we'll just shower them with gifts, or we'll take them to Disneyland, or give them all the love possible. You always want to give your kiddos the love possible, but it's not something that you did wrong and can like, magically just fix it by, cuddling with them for 10 extra minutes a night or something. They're not just going to grow out of it. It can't be willed away, and ignoring the problem isn't going to make it kind of go away either. Also, another myth is that talking about it will make things get worse. So I think a lot of times when something upsetting is going on or negative or bad, we have this tendency to think that like, if we spend time talking about it, you're like fueling it. But the thing is, talking about the sadness with your child, these feelings, this overall what's going on can really help validate their feelings and experience. And you can start kind of being more like a team to tackle it, rather than them feel kind of isolate, for example. So there's a couple interventions I want to get to if you have a kiddo who is presenting with a lot of sadness or down, things like that. So a lot of the things you can do, one I really like is externalizing like that behavior, that feeling from your child. So instead of saying like, you're depressed, you're sad, you're down, whatever it might be, you can start externalizing it and say, the sadness. Or, a lot of the times when you're talking about your kiddo, they might describe it in a way like, I just feel like I have this like, heavy black weight on me, or ball, or this, sad monster inside me, right? A lot of times when a kiddo is using this verbiage, I like to lean into it. So we can say, okay, is that, the sad monster or whatever, is he visiting today? Is he here? Did he just come out? Is he trying to be sneaky and come out today? I noticed you didn't want to, you didn't feel like coming out and playing, and really like you didn't eat much at dinner. Do you think that little sneaky monster's popping out today? You can use like a rating if you have an older kid, 1 to 5, 5 being the most, what do you think it is? So kind of starting to label it, name it, and externalize it a bit. And then also kind of being on their team with it. So there are a lot of things you can do to kind of tackle it. So you can do these check-ins with them. You can see them as their own unique person separate from that. And then you can also start to try and find ways to help them engage in things that do bring happiness. So if your kiddo really enjoys playing Legos, right? You can sit and just kind of play Legos with them. If that like sneaky monster's coming out, right? Like, let's have a plan, babe. When he starts coming out, what do you want to do? What is going to defeat this guy? And send it back in for a little bit. You can start to say, oh, it really helps when we do this, mom, or we do that, or we go for a walk, or we go for a bike ride. Sunshine, all of that is really good. Moving the body. It sounds like, yeah, of course, get outside, vitamin D, but it can really help when we move our bodies. It can really help shift how our mind interacts and engages. Also, it can't, so those are things you can do at home. But if you have a kiddo who really, it's starting to impact, their school, the home, they're not having friends, you can help them through blips of stuff, but it's a biggie. That's when you would want to seek out that more professional support and kind of get plans in place as well. And overall, with both anxiety and depression, or, anything encompassing from like the moderate to the more severe with your kiddos, you shouldn't be doing this alone. Like, I don't want you to feel like the takeaway is tackle it 100% by yourself. I want you to feel like there's lots of support out there for you, whether it's relying on your partner, talking about it, your friends, things like that. And then also as a parent, like you getting your own support, because it can be really hard. We feel a lot of guilt when our kids are struggling. We want it to go away. We want to help them. And it's really tough. And there's a lot of questions as well that could come up. So you can always look online for articles, but there's also a lot of support for you as well. So if you guys have questions, let me know on depression or anything else I talked about. Pop them in, or, unmute yourself as well. I am on this ParentGood app, and I love working with parents. I don't see kids right now anymore, but I love working with parents. I kind of take this strength-based approach. I love working within everyone's, own wheelhouse, and providing strategies together and insight, not only on like what's going on with your kid, like, helping bridge that communication, but also supporting the parents and helping them not feel so alone. So, after this, if you're like, something comes up now or in the future and you're like, oh, I just need to like get something off my chest, or, get some support, or see if this is normal or typical or anything like that. My name is Ashley, and I would love to hop on a call with you. So if you guys don't have any questions, I really, really appreciate you coming. Oh, I see there's the unmute. Yes. Can you, I can't hear you. Hadar. Oh, Okay. It just popped off. But I do have a question. How to find a counselor to help child develop strategies to deal with depression and anxiety. Teenager. Oh, okay, good. There's teenagers on here, parents of. So the best way I would say, there's a couple ways. My favorite is going through your insurance provider, because especially with getting children therapy, it's longer term. It's not like 4 sessions. So it can get expensive. So reaching out to your provider, and they'll give you, a list of people within your network, and then just call. I know it's really tricky because a lot of times people get full, or sometimes they don't call back. I've heard that. Just keep calling. And if you get a hold of someone, don't be super desperate just to book with anyone, especially if it's a teenager. You want their buy-in. You want them to have a good relationship with that therapist. So get that feel for them. Have your teenager involved in finding too. And sometimes you can also pay out of pocket as well. So you can find therapists who are willing to do like virtual or even in person, and you can pay out of pocket too. But I would definitely, I think that would be a good way. Sorry, it just popped away. It's good to get them the support if they're experiencing that. My daughter, 4 years old, struggles with sleeping, attending school, and asking to take part of my body with her take part of my body with her to visit with her dad. We have a terrible co-parenting relationship, and he isn't supportive of her attending therapy. How can I better support her? Yeah, those transitions and divorce is really, really, really hard. So there's a lot to unpack there. I don't want to cut you short with all the information I want to give you. I don't know if you'd ever be interested in hopping on a call with me, but that's something I would love to support you with. I know divorce and co-parenting is really tricky because there's a lot out of our control, but there are some things you can do within the home that are special just with her to help with her and that transition. So I don't want to leave you hanging, but if you ever, I really want to unpack that deeper with you. So if you're interested, or you can even schedule a free 15-minute call with me. So I don't want to skip it over, but, okay. My 9-year-old has been showing signs of depression ever since I gave birth to my second child. They are both girls. My now husband is not the biological father of my first daughter. Lately, she's been asking more questions about her absent father. So I would always suggest being honest with your kids. Answer her questions as honest as you can. And sometimes that means kind of sorting through our own stuff, why we don't want to be honest or what this can mean. But kids will ask questions as far as they're willing to hear the answer for it. And so if your kid is, your daughter's asking a question, I would just show up and make space for her because she's asking, she wants to know. And, it's her own dad. She has that internal right to know, that curiosity and those answers that she has. And the more you lay that foundation now, the later on it's going to open up so many more doors that she's going to feel like she can turn to you and ask questions. And then also it is pretty tricky when you have other kids and when you have blended families and all of that. There can be a lot in there as well for her. So when you say she's been showing signs of depressions ever since and all of that, I'm not super surprised. And I only say that to normalize it a little bit for you, that this is a very typical reaction for kids. Either, they'll start they'll act out when there's been something like that. They'll act out, or they'll be like perfect. They'll get all the straight A's and all of that, or they'll start acting out or withdrawing or something like that because something's going on inside of them. So I would definitely try and connect with her to kind of sort through some of that. And then none of them work online, and my teen will not go anywhere. He doesn't have time. Is there anyone on ParentGood who works with teens? Yes. So, yeah, I don't know. We should circle back to that. I'm not sure if there's anyone that works with teens. If someone else can answer that, Maroni, if you know. But none of them work online. Yeah. There's a lot of other, if you can't find someone on here, there are other apps and stuff that do see kids online, teenagers, or telehealth. There's lots of like outpatient clinics that you can kind of Google too, if you like look within your area. Outpatient clinics who either take insurance or don't, but do offer telehealth. So your son doesn't have to show up in person as well. Okay, I hope that answered you. And yeah, anyone else have a question? Alrighty. Okay. Well, I just want to say, I always like to share that anyone that's doing this kind of work, attending these workshops, trainings, reading things, buying the books, reaching out to therapists, that shows like that you and your family are so strong. It doesn't show that something's wrong in your family, because every single household deals with different things. And the fact that you're showing up for your child and trying to best support them, just so much strength, and how well of a relationship you guys are going to have, and how much you're willing to pour into them, as well as yourself in your home. So I really appreciate you guys showing up tonight, asking the questions and all of that. I really value that in you guys. So thank you so much. I hope you have a wonderful evening. You're welcome, and take care.